Hi students, welcome to the second half of your junior year. This video is an introduction to the unit on pediatric respiratory illnesses. And I'm just going to give you an overview of some of the respiratory disease processes that we will be discussing and learning about in class. The first one we're going to talk about is croup. Croup affects children anywhere from 3 months to 3 years of age. It causes inflammation of the larynx, the trachea, the bronchi, and the bronchioles. This inflammation can lead to mucus and noisy breathing, which can cause the barking cough that we commonly hear with these children who have croup. Croup is an infection of the upper respiratory airway, which causes the voice to have hoarseness and the barking cough. And as you can see, the children's airways are very small, so it's very easy for those airways to get obstructed by mucus and to be swollen. The symptoms that the children can present are upper respiratory infections, fever. You're going to hear the barking cough, the hoarseness, the inspiratory stridor. Usually, these symptoms tend to get worse at night, and children they're usually aggravated by agitation and crying. Some nursing interventions is assessing the lungs and accessory muscles, assessing the cough, increasing their fluid intake. A cool mist air humidifier will help. Chest PT if needed, and some of the medications that may be given to a child with croup is corticosteroids or epinephrine. So the next disease process that we will be discussing is respiratory syncytial virus, or the RSV infection, and that spreads easily by contact or by infected droplets of saliva or mucus. RSV is a common cold in adults and you and I, but it's commonly seen in younger children, especially babies less than 1 year, and with children that with weakened immune systems, maybe children with cancer or cardiac issues. RSV is caused by occlusion of the bronchial airway lumens, which can spread to the lower respiratory tract, and you can see it there. Some symptoms that these babies who have RSV have is that they're usually very irritable and they're usually inactive. They usually refuse to eat, breastfeed, or bottle feed. Lots of trouble breathing. You can see their intercostal muscles working really hard, and they're usually they're usually bringing up some yellow-green or gray mucus. Ways of preventing RSV is when anyone is in the home has a common cold and you have a baby in the house, is keeping clean, washing your hands, keeping the clothes and blankets and the sheets clean, wearing a mask, stopping the smoke. If anyone smokes in the house, you don't want anyone to smoke around your baby. Nursing interventions is for RSV is humidified air, increasing their fluids, and that they can also give them some ribavirin IV if they're in need of it. The next disease process that we will be talking about in class is bronchiolitis. Bronchiolitis usually can occur in infants anywhere from 1 month to 2 years of age. It causes an inflammation and congestion in the smaller airways of the bronchioles, and this is almost always caused by a virus. Some symptoms of bronchiolitis are runny nose, congestion, cough, low-grade fever, difficulty breathing, wheezing, and the child usually develops an otitis media. Bronchiolitis is, as I said, is an inflammation of the lower respiratory tract and the alveoli, so the thick mucus and the edema causes air trapping and overinflation of the alveoli, which you can see here in the picture. Some nursing interventions that you would be performing on the child with bronchiolitis is assessing their airway patency, their frequency of their cough, assessing their lungs, positioning, fluid intake, and for a child that's old enough, maybe having them take deep breaths. Usually they don't recommend antibiotics for a child with a child with bronchiolitis. Bacterial pneumonia occurs when the body's defenses are down and allows germs to invade the lungs and multiply. Some pathogens that cause pneumonia are strep or staph or bacillus, And there's a number of other Klebsiella. These are some other pathogens that can cause pneumonia in the child. Some symptoms are shaking or chills, bluish color of the lips and nose. This can be very common in young infants. Dizziness, headaches, loss of appetite, fever, and of course a cough. And you can see that fluid and pus can fill the airspace, and which contains blood bacteria and blood cells, which cause the alveoli wall to be inflamed. So some nursing interventions for pneumonia, of course, is oxygen therapy, antibiotics, suctioning, coughing and deep breathing, and hydration. The next disease process is cystic fibrosis, which affects cells that produce mucus, sweat, and digestive juices, and causes these fluids to become thick. The diagnosis of cystic fibrosis is usually at a very young age, and it's through a sweat test. So cystic fibrosis becomes present when there's a defective gene related to a protein that is involved in chloride ion transport. Patients with this disease develop a very thick, sticky mucus that clogs the lungs and leads to obstruction, and also leads to obstruction in the pancreas. Some symptoms of cystic fibrosis, again, cystic fibrosis affects the lungs, and it also affects digestion. So you will see the patient with persistent cough and production of thick mucus, wheezing and shortness of breath. They get frequent chest infections, sinusitis, nasal polyps, and they also have a lot of digestive symptoms like weight loss and obstruction and constipation that they have to deal with. Treatment of cystic fibrosis, there is no cure yet, so most of the time they're just doing treatments. Even if they have a lung transplant, that is not a cure for cystic fibrosis, but it does help improve their quality of life. So treatment is you want to increase the calories and the protein in their diet. Pulmonary therapy, chest PT, breathing exercises, aerosol therapy, and of course teaching, working with the parents and teaching them, especially during relapses. And this slide is just an overview of cystic fibrosis, the definition, the symptoms, how they get it, how you can reduce the risks, how it's diagnosed. And the last slides that we're going to talk about, the last disease process is asthma. And asthma is an inflammatory disease in which the airways are sensitive to allergens, and this just kind of gives you a little picture here. And the lining of the airways becomes swollen and inflamed, and airborne allergens are most likely the cause. So here are some triggers for asthma. The trigger can be a respiratory infection, it could be stress, exposure to cold, obesity, pets, dust, drugs. The list can probably go on and on. And some symptoms of asthma is they have difficulty breathing or shortness of breath, a hard time sleeping, especially laying down, wheezing, chest pain, coughing after exercise, or it can actually be triggered by exercise also. And these are just some more causes. Smoking, especially smoking when you're pregnant, can affect the children. Pollution, dust. And the nursing treatment for asthma is bronchodilators and corticosteroids. It also assessment, increasing their fluids, helping them discover what their triggers are is very important. So this concludes my video on an overview of the respiratory system. I hope you enjoyed it, and I'm looking forward to seeing you in class.